Hi, I'm Dr. Bajaj with Illinois Cancer Care. As a place that takes care of our patients with the most modern treatments available, Illinois Cancer Care has always adapted to the needs of the times. We take care of complex cancers, but today we also see a special need to focus on the immediate threat of COVID-19. Our mission remains the same. We are focused on making sure that our clinical sites remain the best places for world-class, compassionate care. Infections from viruses and bacteria are not new to us. Illinois Cancer Care already operates at a high level due to the risk of infection in our cancer patients. We have always been very cautious and particular in following strict infection control measures, and we were well prepared for this pandemic. Steps we have taken to protect you include additional cleaning measures overnight, along with cleaning around the clock to ensure that all surfaces are wiped down between each patient throughout the day. Imaging and lab areas have spaced out appointments and may offer extended hours to accommodate social distancing. We are back to seeing patients in all clinic offices, but will continue to offer telemedicine through video conferencing or a phone call when a clinic visit isn't required or is the preference of our patients. Your doctor will work with you to determine what is best for you. Our medical teams have extensive expertise on how to protect cancer patients from risk of infection, and we follow all of the new regulations and guidance from public health authorities and the Centers for Disease Control regarding COVID-19. If available, each of our clinics is using a separate back entrance for all of our employees to enter in the morning. This ensures that they are able to enter one at a time, participate in a health screening, and receive the personal protective equipment they will wear that day. All of our employees are wearing masks. Many are also wearing gowns, lab coats, caps, goggles, and face shields to protect both themselves and our patients. Employees receive extra training on how to use these protective measures to their highest potential. When you come to Illinois Cancer Care Peoria Clinic, you have options based on your scheduled care. There is a pod outside our main entrance for patients to receive their treatment shots without having to enter the building. There is a separate exit door for our patients who are coming to our clinic for blood work only. Our main entrance is still the entrance to use for imaging appointments or appointments to see your doctor and care team. Throughout COVID-19, we have seen some creative ways that loved ones have been able to find support for their patient without being in the same room. We are doing all that we can to ease the difficulty of this no visitor policy. We will assist you in connecting with your family and friends when you are here for an appointment, by FaceTime, Skype, or by phone. We recognize the challenges that these safety measures present, but please be assured that our care team is here to support you. As always, our decisions are driven by our single purpose, which is to provide you with the absolute best and safest care while protecting your health. You can see here that we have decals on the floor. We ask that you please use these to indicate how close you should stand to another patient or a visitor in our building. We have strategically scheduled patients throughout the day so we can easily maintain social distancing. This is Chastity. She is one of our medical office assistants who greets every person entering the building. Chastity will take your temperature with a touchless thermometer, ask a few screening questions, and hand you a new surgical mask to wear while you are in the building. After this, you will check in at the front desk, just like usual. You can then proceed to your pod or waiting area where chairs have been spaced out for social distancing 6 feet apart. When using the elevator, we ask each patient to take their own turn, and please use hand sanitizer after exiting the elevator. In our treatment rooms, chairs are also spaced out to ensure distancing and are sterilized between patients. Our nursing team keeps IV bags behind the chairs to allow for ease of treatment at a small distance. Don't worry, while we want to limit contact, we will not be limiting our caring smiles or our compassionate care. We require everyone inside to wear a mask, please, at all times, so eating in the treatment room is currently not encouraged. We will make exceptions for diabetics and those who need to eat for medical conditions while they are here during a long treatment program. Our friendly volunteers, including the canines, are not currently present, but their hearts are here, and they have found other ways to support from a distance. The Illinois Cancer Care team understands that this is a difficult time for our patients. We will continue to make adjustments when we can to bring as much compassion and support to your journey as possible. But our top priority will always be to keep you safe.